Welcome to Medicare 360. I'm your host, Jennifer Lee, and today we are going over the Medicare New Handbook. Where we left off was actually on long term care, and I wanted to highlight that again. So we're on page 56 on the Medicare New Handbook, paying for long term care. Medicare and most health insurance, including Medicare supplement insurance, Medigap, don't pay for non medical long term care services. Go to page 43 for home health services. This includes personal care assistance like help with everyday activities, including dressing, bathing, and using the bathroom. Non medical long term care services may also include home delivered meals, adult day health care, home and community based services, and others. You may be eligible for some of this care through Medicaid, or you could choose to buy private long term care insurance. You could get non medical long term care services at home, in the community, in an assisted living facility, or in a nursing home. It is important to start planning for non medical long term care now and maintain your independence to make sure you get the care you may need in the setting you want now in the future. Long term care resources. Use these services to get more information about long term care. Visit acl.gov/LTC to learn more about planning for long term care. Visit the Elder Care Locator at eldercare.acl.gov or call 1 800 677 1116 to find help in your community. Call your long term care ombudsman or visit ltcombudsman.org for help with services you need and to be advised of your rights and to find an ombudsman program near you. Call your state medical assistance Medicaid office or visit medicaid.gov and ask for information about long term care coverage. Call your state health insurance assistance program SHIP. Go to page 114 to 117 for the phone numbers for your local SHIP. Hearing they might do away with that program because those really aren't people that are licensed, right, or certified for Medicare. And it's a more volunteer role, so they might do away with it from what I'm hearing. Call your state insurance department for information on long-term care insurance. Call 1-800-MEDICARE 800-633-4227 to get the phone number. TTY users call 877-486-2048. Get a copy of Shopper's Guide to Long-Term Care from the National Association of Insurance Commissioner at content.nic.org/site/default/files/publication-LTC-LP Shoppers Guide Long-Term PDF. Okay, let's take a little bit more to talk about long-term care. Um, if you are actually at a hospital and you can't quite go home yet, and most of the time, hospitals like to actually kick you out, right? You can go to a skilled nursing facility, which technically has some type of like care component, right? Or like a rehab facility, which is covered through Medicare. But biggest thing is, when you get home, who is going to take care of you? That's the biggest thing I see that can get quite expensive and unaffordable for a person, particularly if you're not on Medicaid or Medi-Cal in California. How are you going to get the extra help? There are some plans that do cover some type of help, but it's going to be very minimal. Some plans allow for a relief of your caregiver, or maybe from an emergency or hospital stay when you go back home from surgery, things of that nature, but it's not full extent. Especially if someone has maybe dementia, mental illness, Alzheimer's, which needs more care per se, versus someone that's mentally there and might just need help with physical activities such as cooking, cleaning, bathing, going to the bathroom. and things of that nature. But it is definitely a good thing to plan ahead, even in your 60s or as soon as you can, because maybe in the 80s or 90s, that's when you probably would need care. And most long term care companies actually have gone out of business for the um, ones that are particular long term care insurance plans, because these long term care insurance plans, they're kind of like a use it or lose it probability, just like healthcare, right? You're paying into a monthly premium, and in the case you use it, perfect, it will be there. But if you don't use it, you don't need it, then all those premiums go down the drain. I've also found that sometimes when a husband and wife are gets a long-term care policy and they one is healthy, one's not, there's like really no rhyme and reason when sometimes one person's premiums go up, one doesn't. And sometimes it's just kind of like those tiers of groups of people. So, depending if your group or tiering has filed more claims, then the insurance company increases your premium versus another group where no claims are filed. So, it's pretty stable, right? So, sometimes I will have like an older spouse paying X amount of premium, and for some reason the younger spouse, which is actually more healthy, has like a way higher premium than theirs. So it's kind of like that. You never know when it comes to that type of insurance. There are hybrids now where it's not particularly just long-term care. So there's hybrids where you could purchase life insurance and might have a component, not particularly long-term care per se, or but will help with the two out of the five living basic living activities to take money out of your life insurance. So that's an option. And there are annuities as well that have the option where you get an annuity, you could get a rider or something embedded where if something were to happen to you and you need long term care, you're able to pull out that money, even maybe double, triple, and use it for long term care. So things like that, definitely give us a call. We could help you out with that because there are different factors and different types of products that you could get to help you with long term care. I think that's a really big issue because I know many don't want to depend on their kids or burden their kids. I've been seeing it way more and more, and it's just something that is going to be an issue later on for more people as there's rising cost for care. Okay, let's move on to section 3, page 57, original Medicare. How does original Medicare work? Okay, so original Medicare is your red, white, and blue card. That's original if you didn't enroll in a supplemental plan or a Medicare Advantage plan. Okay, so let's talk about that. Original Medicare is one of your Medicare health coverage choices. You'll have Original Medicare unless you choose a Medicare Advantage plan or other type of Medicare health plan. Original Medicare includes two parts, which is Part A hospital insurance and Part B medical insurance. You generally have to pay a portion of the cost for each service Original Medicare covers. There's no limit to what you pay out of pocket in a year unless you have other coverage like Medigap, Medicaid, employer, retiree, or union coverage. So, really, I do not recommend Original Medicare because, like mentioned here, that there's no limit to what you'll pay out of pocket in a year if you don't have an additional coverage like the Medigap, Medicaid, employer, retiree, or Medicare Advantage plan. Okay, original Medicare. Can I get my health care from any doctor or other healthcare provider or hospital? In most cases, yes. You could go to any Medicare approved Medicare enrolled doctor, other healthcare provider, hospital, or other facility that accepts Medicare patients anywhere in the U.S. Visit medicare.gov/care-compare to find and compare providers, hospitals, and facilities in your area. I would say most providers will take Medicare, right? It's easy to build for them. They will take Medicare. What I don't see sometimes if it's like a just a Medicaid facility, sometimes like it's only Medicaid or Medi-Cal. Okay. Does original Medicare cover prescription drugs? Okay, Medicare Part B doesn't cover most drugs, but there are some exceptions like immunosuppressive drugs, page 52, or drugs for pain and symptom management for hospice care, pages 26 to 27. Part B may also cover some infused and injected drugs given in a doctor's office and insulin used with a traditional pump. Go to pages 39, 44, and 47. You could add Medicare drug coverage Part D by joining a separate Medicare plan. Go to pages 79 to 90. Okay, so this is a little bit confusing, I would say, because like Medicare Part B does cover like drugs that are like ordered by your doctor and is injected at say your doctor's office, right? And then, like on your original part A and B, there's no invisible, like, there's no D on there, which is drugs, right? And so you just have to know that you do have to get a drug plan because if you don't, you will be penalized for every month that you weren't on it and had to be. Okay, so that's why um, a licensed professional agent like me will make sure that you go over your options, right? Because there are some Medicare Advantage plans that don't come with a drug plan. And those typically are, if you do have credible drug plan coverage somewhere else, like maybe veterans or TRICARE or like a group plan you're in, right? Like I had met this lady, I was at a client's house. She was a sister, and she's like, oh, I already got this taken care of on the phone. But of course, hey, let me review it just to make sure everything's good. She told me that she was getting surgery soon, but I don't take any medication. I told the person on the phone specifically, I don't take medication. I don't need a drug plan, right? But first of all, they put her on a plan that was way worse than any other plans with a drug plan. Second, she's going to have surgery. So she probably will get medication that she needs, right? Third, she needs to get a drug plan. She didn't have any other coverage, meaning she would have been penalized 1% for every single year that month that she wasn't on it. So let's just say I never met her. 2 years go by without a drug plan. So that's 24 months, 24% off the average Medicare Part D cost. So do not go with an agent that's an order taker that clearly doesn't understand how these insurance work because they totally gave her something so wrong or didn't at least give her the knowledge to make the proper decision for herself. It's just so worse when you trust an agent with something that you will be penalized for the rest of your life. So just be careful on that. It's a big thing, I would say. Um, I, I don't know why what person would do that. I mean, an agent, not give someone a drug plan just because they said, I don't need one, right? I mean, be someone's advisor, recommend, or just at least tell them the facts about the penalty. Just mind boggles me, but I do hear that from time to time. So just be careful. Okay. Do you need to choose a primary care doctor? No. If you are on original Medicare, you do not need to choose a primary care doctor. If you're also on a supplemental plan, which is called Medigap, you also don't need a primary care doctor. Do I have to get a referral to use a specialist? In most cases, no. Okay. Sometimes, like when you go to the lab, even if you're on original Medicare and a supplement, right? Like the lab doesn't just want to say, okay, let me run all the tests on you. Like they want a doctor's note, a doctor's referral to run tests on you, right? So things like that, keep that in mind. Okay. Should I get a supplemental policy? You may already have Medicaid or employer, retiree, or union coverage that may cost that original Medicare doesn't. May pay. Yeah. So that may pay the cost, right? If not, you may want to buy a Medicare supplement insurance Medigap policy if you're eligible. Go to pages 75 to 78. You could also check with your state medical assistance Medicaid office to see if you're eligible for Medicaid. What else do I need to know about original Medicare? Okay, so you generally pay a set amount for your healthcare deductible before Medicare begins to pay its share. Once Medicare pays its share, you pay a coinsurance or copayment for covered services and supplies. There's no yearly limit for what you pay out of pocket unless you have other insurance like Medigap, Medicaid, or employer retiree union coverage. You usually pay for a monthly premium for Part B. The premium may change each year, and it also could change based on income. You generally don't need to file Medicare claims. Providers and suppliers must file your claims for the covered services and supplies you get. What do I pay? Your out of pocket costs in original Medicare depend on whether you have Part A and or Part B. Most people have both. Whether your doctor, other healthcare provider, or supplier accepts assignment, go to page 59 to 60. The type of healthcare you need and how often you need it. If you choose to get services or supplies Medicare doesn't cover. If so, you pay all costs unless you have other insurance that covers them. Whether you have other health insurance that works with Medicare, go to page 21. Whether you have full Medicaid coverage or get help from your state to pay your Medicare costs through a Medicare savings program. Go to page 91 and 92. Whether you have Medicare supplement insurance, Medigap, whether you and your doctor or other healthcare provider sign a private contract, go to page 60. How do I know what Medicare paid? If you have original Medicare, you'll get a Medicare Summary Notice, MSN, that lists all services billed to Medicare. The bill isn't a bill, it shows what Medicare paid and what you may owe the provider. Review your MSNs to be sure you get all the services, supplies, or equipment listed. If you disagree with Medicare's decision not to cover a service, the MSN will tell you how to appeal. Go to page 99 for information on how to file an appeal. You'll get this notice in the mail every 4 months unless you sign up to get it electronically. If you need to change your address on your MSN, visit ssa.gov/mycontact. If you get Railroad and Retirement Board benefits, RRB, call the RRB at 877-772-5772. Your MSN will tell you if you're enrolled in a qualified Medicare beneficiary program, QMB. If you're in the QMB program, Medicare providers aren't allowed to bill you for Medicare Part A and or B, deductibles, coinsurance, or copayments. In some cases, you may be billed a small copayment through Medicaid. Fund applies. For more information about QMB and steps to take if a provider bills you these costs, go to page 91. Okay, so the easiest thing in regards to what Medicare covers, there is a Medicare app. You could download it on your phone, and then you just type in whatever service you want, like, hey, chiropractor, acupuncture, is that covered? And it will give you an outline and a detailed on that. So that's a pretty handy app to use. Important, get your Medicare summary notices electronic. Get your Medicare summary notices electronically. Visit Medicare.gov to log into or create your secure Medicare account. If you sign up for electronic MSNs, we'll send you an email each month when they're available in your Medicare account instead of paper copies in the mail. As of late 2024, people who signed up for electronic MSNs helped save the Medicare program close to 42 million. That's awesome. I will probably recommend that to clients because that will help save money. Okay, you have options for how you get your Medicare claims information. You could check your MSN for claims information. You could access your claims in your account on Medicare.gov and share this information with doctors, pharmacies, and others by visiting Check My Claims. You could access your claims through Medicare connected apps. Connected apps are Medicare-approved applications or websites that a third party, not Medicare, creates. When you connect to an app and log in with your Medicare.gov account information, you could use the app services without manually entering your health information. These third parties can only access your Medicare data if you choose to share it with them. It's always your choice if you want to connect or stay connected to a third-party app. Go to page 109. What's assignment? Assignment means that your doctor, provider, or supplier agrees or is required by law to accept the Medicare approved amount as full payment for covered services. Most doctors, providers, and suppliers accept assignment, but always check to make sure yours is due. If your doctor, provider, or supplier accepts assignment, your out-of-pocket may be less. They agree to charge you only the Medicare deductible and coinsurance amount and usually wait for Medicare to pay its share before asking you to pay your share. If you have to submit your claim directly to Medicare and can't charge you for submitting the claim. Okay. We are on page 60. Some providers haven't agreed and aren't required by law to accept assignments for all Medicare covered services, but they can still choose to accept assignment for individual services. The provider who haven't agreed to accept assignment for all services are called non-participating. You might have to pay for more of their services if they don't accept assignment for the care they provide to you. Here's what happens if your doctor's provider or suppliers doesn't accept assignment. You might have to pay the entire charge at the time of service. Your doctor, provider, or supplier is supposed to submit a claim to Medicare for any Medicare covered services they provide to you. If they don't submit the Medicare claim once you ask them to, call 1-800-MEDICARE, 1-800-633-4227. They can charge you more than the Medicare approved amounts. In many cases, the charge can't be more than 15% above the Medicare approved amount for non-participating healthcare providers. The amount is called limiting charge. Compare. If you have original Medicare, you could use any provider you want that takes Medicare anywhere in the US. If you're in a Medicare Advantage plan, in most cases, you'll need to use doctors and other providers who are in the plan's network. Love to talk about this more in detail in our next show. Till next time, you have a wonderful day. Look forward to seeing you soon. Thank you. Bye-bye.